The Sarasota County Eldercare channel is brought to you by Mike Levine and the great folks of Homestead of South Sarasota County. Today's guest is Pam Pawlowski, award-winning dementia practitioner for Infinity HomeCare.
Hello and welcome to the Sarasota County Eldercare channel. My name is Judy Bram and I'm with Homestead Senior Care. I have a special guest with me today, Pam Pawlowski. Pam is a certified dementia practitioner with Infinity HomeCare here in Venice, Florida. Today, Pam's going to tell us about some of the services offered through Infinity HomeCare. So Pam, what kind of services does Infinity HomeCare offer?
Well, Infinity HomeCare is a Medicare home health agency, so we offer a skilled level of care in nursing, physical therapy, occupational therapy, speech therapy. We have an MSW on board as well as a psych nurse. So we have a full complement of skilled practitioners that will go into the home and see the patient on a doctor's order. Of course, we need a doctor's order for that. And it's usually in conjunction with something that has occurred recently. Either they've just been discharged from the hospital or they've gone to the doctor and the doctor says, you are not walking as well. Let's see if we can get a little physical therapy in there, or they just leave the wound care center and they need ongoing wound care at home. So a lot of times it's very specific, and the doctor writes an order for a skilled nurse to do wound care or a physical therapist or whatever clinician they choose.
So Infinity HomeCare would be an alternative for somebody who wants to, the term nowadays is age in place, at home, rather than going to a facility. They want to remain home. Is that correct?
Exactly. And sometimes that can't be avoided, Judy, but we try to keep people in their home. That is our goal, is to keep them at home until it's just not safe anymore for them to be there. So, we evaluate things like their fall risk and if they can't cook anymore. And of course, we have our empowerment programs. We have a congestive heart failure program, a COPD program, a diabetic program, med management program, as well as a cognitive health program, because many of my folks can receive Medicare home health care if they have dementia. So if these people cannot leave home unless somebody brings them somewhere, Medicare says it's okay for us to go in there and care for them. And most of our folks that have some form of dementia also have some other comorbidities. They also have things like diabetes or heart failure or a wound care, especially our diabetics. So for us to go in there, sometimes we might have 2 or 3 different clinicians in there. And our social worker goes in there as well sometimes, and that's to coordinate some Medicaid or VA planning, or to help them get on board with some, if their finances are poor, they will hook them up with the area agency on aging, or if they're there by themselves, if it's a neglect issue, we'll call in DCF and make sure that this patient is really taken care of.
So someone doesn't need to worry about, I can't afford to have a nurse, because it sounds like there's a lot of alternatives for paying for this.
There is. And for us, we are a Medicare home health agency, so we don't do the Medicare replacement plans. We just do Medicare. And for us, we don't do the insurances. So we are focused on the Medicare home health population. That's all we do.
Okay. Yeah. And you mentioned other things like physical therapy, speech therapy, occupational therapy.
And my husband is probably a good example. He just had a hip replacement. He came out of doctor's hospital, and Dr. Vidlin ordered a week and a half of home physical therapy. And when he had capacity to go to outpatient therapy, he was discharged from Infinity and went to outpatient therapy for 2 more weeks. So I think we work in conjunction with outside providers, as well as we take our marching orders from that physician, whether it's the orthopedic surgeon, whether it's the cardiologist. We do what they recommend for our patients. So it was a really good experience. So, you know, we got to see firsthand what it's like to be a Medicare recipient, and for my husband to get his physical therapy, and he did really well. So it was, now I can go back and say, now I know how confusing it gets for my family members trying to coordinate all these appointments. So I have a whole new appreciation for that whole home health thing.
What area does Infinity HomeCare cover around Sarasota?
We cover the entire state of Florida.
Oh.
We have 15 offices, branches throughout the state, and I am in all branches. So I go all over the place.
Oh, wow. It keeps you busy.
It does. It does.
Okay, well, thank you for all of this great information on
My
Infinity
pleasure.
HomeCare today.
Thanks.
If
Thanks so
anyone
much.
out there would like some more information on the services provided by Infinity HomeCare, their contact information is located on your screen. Please feel free to reach out to them. Thank you for watching. I hope you have a great day, and please take a moment to check out some more of our informational videos.